we're actually going to continue on with the news of the day and talk about something that is really affecting all of us.
Yeah.
Is how are we handling this? Because it's not easy to do. And so as the COVID crisis continues to change our lives, it's important to find, those healthy ways to manage the stress. So joining us live via FaceTime with tips for coping with the COVID crisis is therapist Lynn Morris. Lynn, thank you so much for joining us. You're from Didi Hirsch Mental Health Facilities. Let's talk about how you guys are handling this. I'm stressed. He's stressed. It's a whole new world.
It is a whole new world. And, Didi Hirsch Mental Health Services has really been handling it well. Our counselors on our disaster distress helpline and our National Suicide Prevention Lifeline are helping people who are in crisis and feeling that fear and anxiety right now. Last year, we helped 130,000 people who were in emotional and suicidal distress. This year through March, what we're seeing is that we've answered 50 times more COVID-19 calls than we did in February. So the longer this goes on, people are going to feel more hopeless and helpless and become more at risk for depression, anxiety, substance use, and other mental health issues. So Didi Hirsch operates out of 10 sites. We have had to become remote very quickly. So we're using telepsychiatry, we're using telemental health to connect with our clients still. We are still open for mental health services and substance use services for clients who are in crisis right now. And we're having to learn a whole new world and figure this out. But so far, our therapists and our counselors have done an amazing job continuing to help people in crisis right now.
Is there a specific question, a specific concern that seems to be consistent with some of your patients that you're getting?
Yeah, so what we're hearing on our crisis line mostly is fear of losing their job, fear of health concerns, of getting the virus, really a fear for their family members or their elderly parents or loved ones who may get it, and just paying bills, and being able to get out to the grocery stores, especially for the elderly folks. So lots of fear and anxiety right now. So it's important that people know that our crisis line is there to help them.
Also, I think that we're feeling it in a certain way, but I think, our children and our children at different ages. I know, the little kids are feeling certain things. My teenage daughter is feeling something completely different. Depending on where you are in your life, it's affecting you in different ways.
Absolutely. And I think during this time, it's important for parents to, as much as possible, remain calm and to really, they're modeling for their kids now how to handle chaos and crisis. And hopefully that will build resiliency in kids, over time as they're managing this. But it's difficult, especially with parents having to homeschool kids now. So there's several ways to help at this point. And part of it is just taking care of your emotional, social, and physical health. So paying attention to how you're feeling, making sure that you're reaching out for support, getting enough sleep, taking walks, making sure that you're really limiting your news too much, because that can increase the fear and anxiety. And we know connecting with people is really important right now, especially when people are told to socially isolate and have social distance. It doesn't mean you have to be isolated from someone. What that means is we need to connect more, over phone, over chat, over video, and making sure we're checking in on people who are living alone as well, and really giving back where you can. We know that finding ways to give can improve people's health, and doing an act of kindness, buying a grocery gift card for somebody who's in financial distress right now, offering to pick up groceries for someone who can't get to the store, and just saying thank you to all the people who are on the front lines, our first responders, our healthcare professionals, and even our grocery store clerks.
Yeah, absolutely. Really
great tips
really
there.
Good advice. Lynn Morris, we appreciate that. And I think this conversation has to continue because this is not going to end anytime soon. Not tomorrow, not the next day. So there are going to be new things that are going to come up. So I hope that we can talk with you again.
Absolutely. And if somebody is in crisis or feeling suicidal, we want to make sure that they know that the Didi Hirsch Suicide Crisis Line, 1-800-273-8255, has 24/7 caring counselors there. It's confidential and anonymous, and we're there to help.
Thank you. DidiHirsch.org. We appreciate that. We'll also put that information on our website, KTLA.com. Thank you for that. We'll talk to you soon.